Well, it's Mental Health Awareness Month, and now more than ever, it's a time to raise awareness on our well-being. Today on City Chat, Lieutenant Dennis Jeffrey is breaking down the barriers of mental health by training officers to be crisis intervention trained. Could you tell us a little bit about what crisis intervention means?
Certainly. So we have a lot of situations where we're called when individuals are in a mental health crisis, and at that point they're just looking for some help. So what we've done is we use crisis intervention team training, where we provide additional 40 hours of training to our officers so that they understand de-escalation, they have additional resources, and it really teaches a perspective piece. So when they go to these houses, they understand that there's a lot going on in the moment, and maybe this family's been dealing with the situation for years. So when they're calling us, it's usually pretty critical to them. So we just want to give them that perspective to handle that situation effectively and safely.
So it's my understanding that the City of Columbus created this new position for you, so you are the first lieutenant to deal and hone in on mental health. Could you tell us a little bit more about your role and what qualifications you had to achieve?
Sure. So I went through crisis intervention team training myself back in 2003 as a sergeant, just because I want to understand it more, and when I'm, my officers, I wanted to be able to help them in situations. So I became the part-time coordinator of this about 5 years ago, and then about a year and a half ago, Chief Jacobs provided this full-time position, just because it's becoming so complex. There's a lot of different nuances to it, and really it's been really helpful because I can dedicate all my time just to mental health. We also deal a lot with substance abuse. As we know, we're dealing with a heroin epidemic in this county, so I also train officers on administration of Narcan, and so that's another major part of my job, is making sure they're trained and equipped with Narcan so they can respond effectively.
What is Narcan?
So Narcan is a drug that we provide to individuals who are having a heroin or opiate overdose, and it just kind of counteracts that drug, so we can go in there and get them help immediately. So it blocks the receptors for that opiate. So for about a 30-minute cycle, we can kind of get in there and help them, get them to the ER if needed.
I can't imagine what it would be like to have to be on scene or to be in that position where someone is having, like a mental crisis, because you don't really, you feel kind of like out of control. What are some of the things, some of the tips that you teach, these other officers on how to handle that type of pressure?
So obviously we do everything under a safety umbrella. So we want to make sure it's safe, but when it's safe, we want the officer to slow down, because really you have to find out what the problem is. A lot of times we're communicating with these people, they may not be understanding our questions or our instructions, so sometimes you have to just give it some time. And that's the major thing. Slow down, try to assess the situation, and see where we can bring that individual for help. Sometimes we may have to take them to a hospital. Sometimes we take them to NetCare, which is a county crisis center. Sometimes we leave them in the home if we feel like they have some support system available and they're safe. So really it's almost triaging that situation for that officer, trying to figure out what's the best steps and what's going to make that person safe in the community.
So in addition to this training, there are also resources that the Division of Police has, like you talked about NetCare.
Sure. So yeah, NetCare is a center. It's on the west side, and we bring a lot of folks there that need help. And there's also some other, Southeast Mental Health. So the county's broken up into a lot of mental health providers. So a lot of times these folks are already connected to a mental health provider. It's just they've stopped maybe taking their medication, or they've stopped going to appointments. So we try to re-engage them with that provider to kind of get them back on track, to become healthy again.
Yeah, that's wonderful. When you're on scene and you're dealing with a certain situation, like a lot of times mental health is, it's kind of undetectable. How do you know if someone is, really going through something like that, or if it's, I wouldn't really know how to determine.
Yeah, a lot of times we get a third-party caller. They've observed something that this person has done. Sometimes it's just, a lot of these folks, unfortunately, we've been to their homes multiple times, so we already have a kind of a record. And sometimes you just have to take time. You may go on a run, like a burglary report, that seems just that, but after you talk to someone for a few minutes, you might see some behaviors that just don't seem right. So then we ask the officers just to kind of build upon that to try to get to the root of the issues.
What help do you provide?
So we have a new service that's called Mobile Crisis, where we have a CIT officer, a Columbus CIT officer rides with a NetCare social worker. And they respond to runs in real time, meaning they have that extra level of expertise because we have a social worker that has additional training and resources. and they can really help navigate where that person should go in the moment. So that's something that we're really proud of, and it's gone great. We've been doing it for about a year now.
What are some examples of crisis intervention?
You've probably seen some. We do have individuals that get on bridges and parking garages. So many times a CIT officer. So our goal, whenever one of those runs is dispatched, is to get a CIT officer there. That person has the extra ability to speak to them, and really just trying to get that person to a level that they can communicate with them effectively. Kind of bring them down to a level that they can talk to them and see what the real overlying issue is. And just building that trust and empathy is really critical at that point.
Is it hard to decide whether it's a mental health issue or if it's a criminal act, or both?
A lot of times it's both, where you might have a barricade situation where someone has made threats to someone. If you get into certain crimes like domestic violence, those are pretty hard. Those are mandated. We have to take that person to jail. But what's preferable is if they have broken the law and we can summons them, meaning we basically have them appear in court and we don't arrest them that night, and then we can get them to a mental health facility, get them evaluated, that a lot of times is more effective, because now we're really addressing both issues, the criminal act and also their mental health issues, to get them assessed properly.
I can tell that you care a lot about this, and so where is that all coming from?
No, I mean, officers do care, and in 2018, we went on almost 20,000 of these type of runs. So we're going on them all the time. So I just ask family, if you feel like your loved one's in some type of crisis, to call us, and we'll come out and we'll assess them, the best we can, and get them to a place of safety, and then try to help the family out as well.
For more information on where to get help, visit www.columbus.gov/police, and you can call 614-645-4545. Thanks for watching City Chat on CTV.